The question then comes up as, well, how do you incorporate this into the treatment paradigm? And I think, really in a patient who's had upfront THP and then T-DM1, at the time of progression, you then have the option of giving capecitabine, trastuzumab, and tucatinib, or to consider DS-8201. And so I think at that juncture, you sort of need to make a decision about what regimen you would choose. I think for a patient who has brain metastases, we have data from HER2 CLIMB that suggests that this regimen improves outcomes for patients with brain metastases, whereas we don't yet have data about DS-8201 and its outcomes in patients with brain metastases. There were 24 patients in the DESTINY trial with a history of brain metastases, but they couldn't be progressive or untreated. And so we just don't have substantial data about that agent at this time in that setting. And so I think for a patient who comes in with progressive brain metastases or untreated brain metastases, that using the HER2 CLIMB regimen should be the sort of option that we probably choose in that third line setting. For someone without brain metastases, certainly we could consider trastuzumab deruxtecan, and then you can always utilize the other regimen at time of progression. So it's really exciting to have so many options for our patients, even in that third line and beyond setting.